I'm Sanjiv Chopra, Dr. Sanjiv Chopra. I'm a professor of medicine at Harvard Medical School, and I had the privilege of serving as the faculty dean for continuing medical education at Harvard Medical School for 12 years. My specialty is hepatology, liver disease. Yeah, so let's first start by defining non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is so termed because if we look at the liver tissue under the microscope, it looks just like alcoholic liver disease. But these individuals are not drinking alcohol, or they're drinking alcohol in very minor amounts, not enough to cause liver damage. And hence the term non-alcoholic fatty liver disease. Who are these individuals? These are individuals with obesity, type 2 diabetes, hypertension, high cholesterol, high triglycerides. We often refer to this as the metabolic syndrome. And in our country, over the age of 60, an astounding 40% have metabolic syndrome. You see a patient with hypertension, with type 2 diabetes, obesity, step back and ask yourself the question, does my patient also have liver disease? The estimate now is that there are 70 to 100 million Americans with non-alcoholic fatty liver disease. And most of them don't know it because it doesn't lead to any symptoms. Good for the patient that they don't have symptoms, but bad in the sense that then it can progress and march on to cirrhosis and complications, including liver cancer, cancer rising in the liver, and the need for liver transplantation. So currently it's detected when a patient or individual goes and sees their primary care physician. And at examination, they notice that they have an enlarged liver. And then on the skin, usually in the upper torso of the body, there are prominent arterioles called spider nevus. It looks like a spider with a central dot and the legs emanating from it. And you see palmarethema, spider nevi, the liver is enlarged. Oh, this patient has liver disease. Let's investigate. Or they don't find that. They nevertheless notice that the liver enzymes, two common liver enzymes, ALT and AST, are elevated. And then it's repeated and it's elevated. And that leads to a comprehensive workup for liver disease. And part of that workup is usually an ultrasound. And on the ultrasound, the radiologist might say the liver is enlarged. It is bright and echogenic, consistent with fatty infiltration of the liver. Other forms of liver disease and more advanced liver disease cannot be excluded by this study. So here's something very important. The ultrasound, CAT scan, MRI, if they show a small nodular liver on the right upper part of the abdomen, the spleen on the other side is enlarged, there are prominent veins, which we call collaterals, they can say quite confidently, I think this patient has cirrhosis of the liver. But if they don't see that, the patient could still have cirrhosis of the liver. It could be in the early stages, but it could progress in the next few years and lead to debilitating and even fatal complications. And what we need are non-invasive markers, whether it's a special ultrasound or a battery of blood tests that will detect non-alcoholic fatty liver disease at an early stage. So I think the technology that ArrowDiagnostics is developing fits the bill as being very good technology. The technology has to be inexpensive. It has to be non-invasive. We're not doing a liver biopsy. The liver biopsy, regardless of whether we do it by ultrasound marking, done by an experienced hepatologist or a radiologist, is still invasive and can lead to serious complications on rare occasions. Liver biopsy is also subject to sampling. When we take a 2 centimeter core of liver tissue, we're looking at 1/50,000th of the entire liver volume. So if you take 2 cores of tissue, okay, you're looking at 1/25,000th of the entire liver volume. ArrowDiagnostics, their test looking at protein markers and messenger RNA looking at very sophisticated technology, can assess the severity of liver disease inexpensively, non-invasively, at the point of care. That's going to be huge. So primary care physicians, we need to do two things. We need to educate them about how this is a serious disease. It's the most common liver disease in our country and in many different parts of the world. At the moment, the only important treatment, the treatment that works, is weight loss. But if we have a test as ArrowDiagnostic holds promise for, that will be sensitive, it will be inexpensive at the point of care, it's going to be very, very valuable.